Now we'll be looking at the lax section, or item numbers 24 through 33, and we're going to continue with our Blue Cross Blue Shield claim. When we look at item number 24, this is where we indicate the dates of the services that were provided, where the services were provided, CPT codes, charges, and what physician rendered services. So let's look at each one of these individually. The first one is item number 24A. Item number 24A is where we indicate that the date that the services were provided. Notice that I'm putting in a 2-digit month, a 2-digit date. When I fill these out, I should be able to put a 4-digit year in here, but this particular form is only letting me put in a 2-digit year. Notice we have from and to. If I'm seeing a patient in the office and I'm only seeing them on one date, I don't have to fill in the next dates. I get to leave that blank. If I'm seeing a patient in the hospital and I'm seeing the patient using the same CPT code for several days in a row, I can simply here put 10-1 to 10-5 and indicate that I'm using the same code for those dates. So that's when we would use that. Since we are in the physician's office, I only have to put in one date. Item 24B is the place of service code. Place of service codes can be found on the very first page of the CPT manual. This is where I indicate where the patient was seen. If the patient was seen in the office, that's code 11. If they're seen in the hospital or if they're seen in the emergency room, that's a different code, and we would have to be able to put the right place of service code here. Item 24C is where we indicate whether or not this was an emergency. An emergency is defined as a threat to life or limb. Most insurance companies do not require that we indicate whether or not this was an emergency visit, and so we really have to know the rules of our particular insurance carriers when we fill this form out. For Blue Cross Blue Shield, Medicare, and Medicaid, we get to leave these blank. The next item, 24D, is where we put in our procedure codes. And this particular patient was seen in the office for a level 3 established patient office visit, or 99213. Only CPT codes go here. The next one is where we can put in modifiers. And we can put in the 2-digit modifier, and we can have up to 4 2-digit modifiers on this particular form. Don't need a modifier with this particular code at this time, so I get to leave that blank. Item number 24E is the diagnosis pointer. This is where we have to link our procedure code to the diagnosis. We have to have a reason why we're performing each one of the procedures that we do. Doesn't mean that I have to write what the ICD-10 code is in here. What I actually do is I indicate whether it's A, B, C, or D, or L, or whatever the number is that corresponds to my particular ICD-10 code or diagnosis code. I only have one for this particular claim, so this makes it easy. I put an A in here. Item 24F is where I actually finally get to put in the charges, and for this particular charge, it's $62. Item 24G is where we tell the insurance company how many times we're charging this particular code. 99213 is an evaluation and management code, so we only get to charge that once. So a 1's going to go there. There are some other codes, however, that we can charge 2, 3, or 4, or 5 times or more, depending on what the definition of that particular code is and what we're actually charging for. What you need to understand is that when we put the charges in on F, this is the total charges for the multiple times that we were charging. So let's say I was going to charge this code twice. Instead of putting in $62 into item 24F, I would actually put in $124. So when we put our charges in, it's the total charges for the services rendered. The next box, item 24H, has to do with Medicaid and early family planning services that are provided for some of our patients, and we're going to leave that blank since this is a Blue Cross Blue Shield claim. The next one is the rendering provider's NPI number, and we need to put this in for every charge. We need to put in the rendering provider's number in this box. So we're going to go ahead and we're going to put the doctor's NPI number in here. Now, if we have another charge, we can go in and we can go ahead and continue to put charges in. I can put up to 6 CPT codes on a claim form. So I can have up to 12 ICD-10 codes, and I can have up to 6 separate CPT codes in this particular form. And so patient, we needed to do an EKG on this particular patient, so I'm going to be putting that code in here for that. And we did it because they came in complaining, I believe, chest pain, and I'm going to put in the amount here. We only did one of those, and I'm going to go ahead and put this code in here, the MPI provider's number. You always want to make sure that you have the correct number here, so I need to go back and adjust this number here, which we can always do. All right, so I'm finished with recording my procedures for this particular patient. So now I need to come down and I need to put in the federal tax ID number. The federal tax ID number is, we would indicate whether it's a employer identification number or if it's social security number. For solo practices or practices that are owned by a physician, a lot of times they'll file it underneath their social security number. Larger clinics will have an employer identification number or an EIN. Since our physician works at Wadsworth Medical Center, we're going to be putting in the EIN number for Wadsworth Medical Center. When we do this, we don't put in any hyphens. We put it in as one number. And then we need to indicate which number it is that we entered into this particular item. Item number 26 is for the patient's account number. The insurance company doesn't really need to know what the patient's account number is, but it is a reference back for us so that if we do have any problems with the claim and we need to look at it and resubmit a claim or need to look at what we submitted, then it gives us a reference number back to the patient chart, which is really good. Item number 27 is whether or not do we accept assignment. In other words, do we accept payment from the insurance company? And all of our claims, we're going to mark yes for this. Item number 28 is the total charges. We simply total up the amount that we have charged in item number 24F. And for this particular case, that's $132. The next one is the amount paid. This is where we indicate how much the patient paid for the services that were rendered. You have to put something in this box. If they didn't pay anything, then we put zeros in. If they paid their copay or made some other kind of payment, we're going to indicate that there, but we need to put something in this particular item. Item number 30, we leave blank. Item number 31 is for the physician's signature. We actually used to put in the physician's name and their credentials here, but we no longer need to do that. Item number 31 is left blank. I'm going to skip item number 32 and go straight over to 33, and we'll come back to 32. Item number 33 is where we indicate the billing provider's information and phone number. If we are in a solo practice or a practice that's owned by our physician, then we're going to put that provider's information here. And I can go ahead and put the provider's name here and the street address of where the office is at. If I do that, because I'm going to put the physician's NPI number down here, I don't have to put anything in item number 24J. For the forms that we're going to be filling out, we're going to be filling them out for physicians who work at a large clinic. I need to put the clinic's information. This is the clinic phone number, the clinic address, and remember that the clinic has its own NPI number. I'm going to be putting in the information here, and I'm going to put in this area code here. Then I'm going to be putting in the phone number. And as I put in the phone number, I want you to notice how I do not put any hyphens in the phone number like we normally do. We're just going to go ahead and put that 7-digit number right across that way. Now I can go ahead and put in the name of my clinic here. I'm going to put the address of the medical center here. And I can abbreviate. And notice how I put no punctuation here. Item 33A is where we put the MPI number for the clinic, not the physician's. The physician's MPI number has already been indicated up here in box 24J. So I'm going to put the clinic's NPI number. So this indicates here, this address and phone number is the address where my place of service was rendered. So when I have 11 here, I need to put the clinic's information here in box 33. Let's go back to 32. If my services were rendered any place other than 11, I need to indicate the name of the facility along with the address and the facility's NPI number in this particular box. Now, this usually occurs if I am charging for seeing somebody like in the emergency room or maybe a minor emergency clinic or in the hospital. If my place of service is something other than 11, not only do I need to fill out box 33, but I will also need to fill out box 32.